Hello, I'm Dr. Brandt Gibson, and I'm going to post again today. This video did not post last night, but the idea of it was to talk about pregnancy and varicose veins. So varicose veins are a very common problem from pregnancy because of the pressure that the uterus and the abdomen actually will place on the vessels of the legs, of the lower extremity. And as they put that pressure, you get retrograde pressure in the veins that cause a failing of the valves. So the way the body is designed is you have the arteries that pump the blood to the legs or to the extremities, and then the veins that go back. And so with each pumping of the heart, the vessels expand and contract, and they go down. And then with the veins, because you're working against gravity, for example, in the lower extremity, they have valves, almost like stairs or steps or a ladder, where you actually, each time the heart pumps, you go up a level, stop at the valve, and you go up to the next level and stop at the valve. The problem with that is if these valves start to fail. And if you get enough retrograde pressure, you get enough pressure pushing against the valves will start to leak, and you get the fluid seeping back down. This is one of the reasons that we talked about edema in pregnancy. But the other side effect of this is the valves are failing. The body tries to find a way to get that blood back, and it creates additional vessels, varicose veins. And these varicose veins can become problematic because they can become inflamed and enlarged and painful, and they get worse throughout the pregnancy in a lot of cases. And so because of that, there are a couple different things you need to be worried about with pregnancy. One is the varicose veins themselves. Things that you can do to reduce some of the same things you'll do to reduce swelling, reduce the edema in the legs, is getting your feet elevated when you have the opportunity, the way that you're sleeping at night, those kind of things. But more importantly, there are things you can do to prevent them, like compression stockings. Although compression stockings are often uncomfortable and hot, especially in the summer, they will keep you from getting, or progression of these varicose veins, keep them from getting worse. So varicose veins are not necessarily a problem in and of themselves, but a lot of times they become a problem as they progress, as they get worse over time, and as you go through multiple pregnancies, those kind of things, and they can become a long-term issue with circulation. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 317.